At 34, a Wake County mom was faced with life-changing decisions after she learned she had breast cancer.
Just 34 years old. After surgery, chemo, and radiation, she's facing a whole new battle, tackling the mental toll. WRAL health reporter Grace Haba introduces us to the Duke Health program, helping young patients move forward.
Quiet and crucial. These moments of mental stillness have become a vital lifeline for Iris Bugbee.
I was 34 years old when we found a lump.
Suddenly diagnosed with breast cancer, she found herself in her mid-30s, in the middle of medically induced menopause.
We did 6 rounds of chemo, bilateral mastectomy, and then 17 rounds of radiation.
All with a 2-year-old, a husband, and their family's future to think about.
I was in that waiting room with 60 and 70-year-old women. I know that I'm this young, but I sometimes feel like people forget I'm this young, but I have this much more time left, that I have to live through this.
It's an experience Duke Health clinical psychologist Caroline Dorfman says is both unique to and extremely common among young cancer patients.
They're at a time in their life when they're trying to build their careers, build their families. Young people don't necessarily have the same financial reserves as somebody who is older, and that can be a significant source of stress.
One study found Americans diagnosed with cancer before they were 39 were 40% more likely to have depression and 20% more likely to have anxiety than the general population. Fueled by NIH funds since 2019, Dorfman and those with the Duke Teen and Young Adult Oncology program have been working to change that.
We really want to make sure that if they're surviving in a way that we can maintain their quality of life moving forward. And that really comes with intervening on some of these psychological symptoms early.
By connecting patients to resources and to others in similar shoes, the program is helping patients like Bugbee better manage their new realities.
Kind of helped me acknowledge my body that went through this significant series of events, and now understanding, okay, well, what can I do for myself to work on these things?
In Wake County, Grace Haba, WRAL News.
Just trying to have some self-care there is really so great. The program has the goal of enrolling 260 people over the next 4 years. It's open to people across the state, and you do not have to be a Duke patient to get involved. WRAL dives deeper into stories like Iris's in our documentary, Diagnosis Young, the new face of cancer in North Carolina. You can hear more of those stories right now on our website, WRAL.com.